Ladies and gentlemen, good day! We stand before you today to present a comprehensive and insightful class report that delves into the deep thought study of drug. In this topic given to us entitled The Drug That Affects the Heart, Blood Vessel, and Blood.
Pharmacology, where we delve into the art of science and drugs. In this class report, we embark on the exciting exploration of the captivating world of pharmacology, critical knowledge, skills, and discovery to pursuit of improving human health.
So first, review the hemodynamics. Hemodynamics is a study of the movement of blood through the body's circulatory system. It involves the study of various parameters such as blood pressure, blood flow, and resistance to blood flow. Reviewing hemodynamics is important in diagnosing and treating many cardiovascular disease. So one key parameter in hemodynamics is blood pressure, which is the force of blood pushing against the walls of the arteries. Blood pressure is measured using two numbers, which is the systolic and diastolic, and is expressed in millimeter of mercury. High blood pressure or hypertension is a common cardiovascular disease that can lead to serious health problems including heart attack and stroke. Blood flow is another important parameter in hemodynamics. Blood flow is the volume of blood that flows through the blood vessel per unit of time, and it is dependent on the pressure and resistance to the blood flow. The resistance to blood flow is determined by the diameter of the blood vessel. The length of the blood vessel and the viscosity of the blood is hemodynamic can be measured using various non-invasive and invasive techniques, including echocardiography, catheterization, and pressure volume loop analysis. These techniques allow doctors to diagnose and monitor cardiovascular disease such as heart failure, valvular heart disease, and coronary artery disease. In summary, overall, reviewing hemodynamics is crucial in understanding treating many cardiovascular disease, blood pressure and blood flow, and resistance to blood flow are important parameters in hemodynamics and can be measured using various techniques, understanding, and can help doctors make informed decisions about diagnosing, treating, and management of cardiovascular disease. So second, drugs acting the renin-angiotensin-aldosterone system is a complex physiological pathway that plays a crucial role in regulating blood pressure, fluid and electrolyte balance, and overall cardiovascular function. Drugs that affect on the renin-angiotensin-aldosterone system are commonly used in the management of hypertension, heart failure, and other cardiovascular disease. Angiotensin converting enzyme inhibitor to or ACE inhibitors or are a class of drugs that block the conversion of angiotensin 1 to angiotensin 2, a potent vasoconstrictor. By reducing the level of angiotensin 2, ACE inhibitor decrease peripheral resistance and lower blood pressure. Example of ACE inhibitors include lisinopril, enalapril, and ramifil. Angiotensin receptors blocker or ARBs are another class of drugs that act on the renin-angiotensin-aldosterone system by blocking the binding of angiotensin 2. So its receptors like ACE inhibitors, ARBs reduce the pressure by dilating blood vessel and decreasing peripheral resistance. Common examples of ARBs including losartan, valsartan, and candesartan. Aldosterone antagonists such as spironolactone and plerinon block the action of aldosterone, a hormone that promotes sodium and water retention. By inhibiting aldosterone, this drug promotes the excretion of sodium and water, leading to reduction in the blood pressure and fluid overload. And conclusion, drugs that act on the renin-angiotensin-aldosterone system have become an essential component in the management of cardiovascular disease by targeting key components of this complex pathway. These drugs help regulate blood pressure, fluid balance, and overall cardiovascular function, thereby improving patients' outcome. So, calcium channel blocker or CCB are a class of medication commonly used to treat conditions such as hypertension or high blood pressure, angina, chest pain, and arrhythmias or what we call abnormal heart rhythms. CCB work by blocking the influx of calcium ions into the smooth muscle cells of the blood vessels and the heart. This reduces the contractility of these muscles to leading vasodilation or what we call widening of blood vessels and decreased workload on the heart. Although CCB are generally well tolerated, they may have some side effects such as the headache, dizziness, flushing, and constipation. This drug can also interact with other medications, so it's important to inform your doctor about all the medication you're taking. Some specific types of CCB include the dihydropyridines such as amlodipine and nifedipine, and non-dihydropyridines such as viramil and diltiazem. Each type has its unique effect and uses. It's crucial to take CCB as prescribed and not to stop taking them suddenly without consulting your doctor. Abrupt discontinuation of CCB can lead to rebound hypertension and other adverse effects. Overall, CCB are an important class of medications that are effectively manage various cardiovascular conditions when used appropriate understand and guidance of a healthcare professional. So for the fourth topic, vasodilators are the class of drugs that work by relaxing the smooth muscle in the blood vessels, which lead to an increase in their diameter and decrease in the blood pressure. This makes them an important treatment option for the various cardiovascular conditions such as hypertension, angina, and heart failure. One type of vasodilators is nitric oxide or NO donors. These drugs release nitric oxide, which is a potent vasodilator and helps to increase blood flow to various organs, including the heart and brain. Another type of vasodilator is calcium channel blockers, which is earlier I already said uh, this CCB block the influx of calcium into a smooth muscle cells, which helps to relax blood vessel to decrease the blood pressure. So while the vasodilators can be highly effective in treating cardiovascular conditions, they are not without their side effects. Some common side effects of vasodilator includes headache, dizziness, flushing, and a low blood pressure. In some cases, vasodilators can also interact with other medication and cause serious adverse effect. It is important to note that vasodilators are not a cure for cardiovascular condition but rather a way to manage symptoms and prevent complication. So, in addition to taking medications, changes such as exercise, healthy diet, good nutrition, and stress reduction can also be important in management cardiovascular health. In conclusion, vasodilators are an important class of drugs that can help to treat cardiovascular condition by relaxing blood vessels and decreasing blood pressure. However, like all medication, they have their side effects and limitations. Um, Consultations with a healthcare professional is necessary to determine whether vasodilators are a suitable treatment or option and to ensure their safe and effective use. So, uh, dr- uh, Drugs and hypertension. Hypertension is commonly known as a high blood pressure is a medical condition in which the force of blood against the walls of arteries is consistently too high, leading to increased risk of heart disease, stroke, and other complications. One of the commonly used treatment for hypertension is drug therapy. Several classes of drugs are available treat to treat hypertension, including diuretics, beta blockers, ACE inhibitors, ARBs, and calcium channel blockers, and others. Each of these classes of drugs works in a different way to lower blood pressure. Diuretics work by removing excess fluid and sodium from the body, thereby reducing the blood volume and blood pressure. Beta blockers work by blocking the effect of adrenaline on the heart and the blood vessel, thereby reducing heart rate and blood pressure. ACE inhibitors and ARBs work by blocking the effect of angiotensin II, a hormone that constricts blood vessels, thereby reducing blood pressure. Calcium channel blockers work by relaxing the smooth muscle of blood vessel, thereby reducing by blood pressure. While these drugs are effective in treating hypertension, they may have side effects and their uses should be carefully monitored by the healthcare professional. It's also important to note that the lifestyle changes, such as maintaining a healthy weight, exercising regularly, eating a healthy diet, and reducing salt intake, can also help to lower blood pressure and reduce the risk of complications associated with hypertension. In conclusion, drug therapy is an important tool in the management of hypertension, and there are several classes of drugs available to treat this condition. However, their uses should be carefully monitored by the healthcare professional, and lifestyle changes should be also implemented to help reduce blood pressure and prevent complications associated with hypertension. So for the fifth topic, drugs for heart failure. So we all know that heart failure is a serious medical condition in which the heart is unable to pump enough blood to meet the body's needs. There are the several types of drugs used to treat heart failure, which with its own mechanism of action and benefits. Here, here's some medication or the main drugs classes used in the management of heart failure. So first, the diuretics. This drug helps to remove excess fluid from the body, which can reduce the workload on the heart and improve symptoms such as shortness of breath and swelling in the legs. Common diuretics used in heart failure include furosemide and spironolactone. So, ACE inhibitor and ARBs, these drugs help to dilate blood vessel, which can improve blood flow and reduce the workload on the heart. They also help to reduce blood pressure and fluid retention. Common ACE inhibitor used in heart failure include lisinopril and enipropil, while losartan is a common ARB. So, third, beta blockers. These drugs help to slow down the heart rate and reduce the workload on the heart. They can also improve symptoms and reduce the risk of hospitalization and death. Common beta blockers used in heart failure include carvedilol and metoprolol. So, last, aldosterone antagonist. These drugs blocks the effect of the hormone aldosterone, which can lead to salt and fluid retention. They can improve symptoms and reduce the risk of hospitalization and death. Common aldosterone antagonists used in heart failure including spironolactone and eplerenone. It's important to note that these drugs are typically prescribed by combination with each other and with lifestyle changes, such as reducing salt intake and increasing exercise. It's also important to follow your doctor's instructions carefully to report any side effect or changes in symptoms. With proper management, drugs for health and failure can help improve quality of life and reduce the risk of complication. So for the antidysrhythmic drug or class of medication used to treat abnormal heart rhythms or arrhythmias, this medication work by either slowing down or speeding up the heart rate or by restoring the heart normal electrical activity. While this drug can be effective in treating certain types of arrhythmias, they can also have serious side effects and should be used with caution. One common type of antidysrhythmic drug is a sodium channel blocker, which work by blocking sodium channel in the heart cells, slowing down the electrical impulses that caused in the heartbeat. Example of sodium channel blockers include quinidine and lidocaine. Another type of antidysrhythmic drug is beta blockers, which work by blocking the action of adrenaline on the heart, slowing the heart rate and reducing its workload. Example of beta blockers including metoprolol and propranolol. Calcium blockers are another type of antidysrhythmic drug which work by blocking the entry of calcium into the heart cells, relaxing the heart muscles and reducing its workload. Example of calcium channel blockers include diltiazem and verapamil. While antidysrhythmic drugs can be effective in treating arrhythmias, they can also have serious side effects such as heart failure, low blood pressure, and arrhythmias that are worse than the original problem. It's important for the patient to work closely with their doctor to monitor their heart rhythm and adjust their medication as necessary. In some cases, other treatments such as catheter ablation or surgery may be necessary to treat arrhythmias.
Prophylaxis of atherosclerotic cardiovascular disease, drug that help normalize cholesterol and triglyceride levels. The management and prevention of atherosclerotic cardiovascular disease or ASCVD often involve the use of medication that help normalize cholesterol and triglyceride levels. These drugs are typically prescribed as part of the comprehensive approach that includes lifestyle modifications such as a healthy diet and regular exercise. Here are some common medication used for this purpose. Statins. Statins are the most commonly prescribed drugs for reducing LDL cholesterol level, which is often referred as bad cholesterol. They work by inhibiting an enzymes involved in cholesterol synthesis, thus lowering LDL cholesterol levels and reducing the risk of cardiovascular events. Next medication is the ezetimibe. Ezetimibe is a medication that lowers LDL cholesterol by inhibiting its absorption in the intestines. It is often used in combination with statins for individuals who cannot achieve their target cholesterol level with statins therapy alone. Next medication is the PCSK9 inhibitors. These newer medication help lower LDL cholesterol level by increasing the liver's ability to remove LDL cholesterol from the bloodstream. They are typically reserved for individuals who cannot tolerate or do not respond well to statins therapy. Next medication is fibrates. Fibrates are primarily used to lower triglycerides level and increase HDL cholesterol, also known as good cholesterol level. They work by reducing the liver's production of triglycerides and increasing the breakdown of triglycerides in the bloodstream. Next medication is the omega-3 fatty acid. Omega-3 fatty acids, particularly eicosapentaenoic acid or EPA and docosahexaenoic acid or DHA, help lower triglycerides level. They are commonly found in fish oil supplement, and can be used as an adjunct to other lipid-lowering medication. It's important to note that these medications are usually prescribed based on the individual's specific risk factors, such as their lipid profile, age, and overall cardiovascular health. The decision to use this drug, as well as the choice of specific medication, should be made in consultation with a healthcare professionals who can assess the individual's unique situation and make appropriate recommendations. Drugs for angina pectoris. Angina pectoris is a condition characterized by chest pain or discomfort that occurs when the heart muscle does not receive enough oxygen-rich blood. Several medications are commonly used to manage and treat angina pectoris. So, here is the simplified explanation for these drugs. First drug is the nitroglycerin. Nitroglycerin is a medication that helps relieve angina symptoms by relaxing and widening the blood vessel, allowing more blood to flow to the heart, and it can be taken as a tablet or as a spray under the tongue. Nitroglycerin provides quick relief for acute angina episodes and can also be used preventively before engaging in activity that may trigger angina. Next is the beta blockers. Beta blockers are a class of medication that work by blocking the effects of adrenaline on the heart. They reduce the workload on the heart, can help lower blood pressure, thus reducing the frequency and severity of angina episodes. Beta blockers are often prescribed for long-term management of angina and can also help improve exercise tolerance. Next medication is the calcium channel blockers. Calcium channel blockers are another class of drugs used to manage angina. They work by relaxing the blood vessel and reducing the workload on the heart, thereby improving blood flow and relieving angina symptoms. Calcium channel blocker can be prescribed as short-acting medication for acute relief or as long-acting medication for ongoing angina management. Next drug is the aspirin. While not specifically a drug for angina, aspirin is commonly recommended for individuals who with angina pectoris. Aspirin helps reduce the risk of blood clot forming by inhibiting platelet aggregation. By preventing blood clot, aspirin can reduce the likelihood of a heart attack or stroke, which can be associated with angina. Next medication is the renalozine. Renalozine is a medication that works by reducing the heart's demand for oxygen. It can be used on an add-on therapy for individuals who continue to experience angina symptoms despite treatment with another medication. Ranolazine may be prescribed in combination with other anti-anginal drug to provide additional reliefs. It is important to note that the choice of medication and treatment approach may vary depending on the individual's specific angina symptoms, underlying condition, and overall cardiovascular health. A healthcare professional will evaluate these factors and make appropriate recommendations to manage angina and improve quality life. Anticoagulant, antiplatelet, and thrombolytic drug side effects. The anticoagulants prevent the formation of clot that inhibit circulation. The antiplatelets prevent platelet aggregation. clumping together of platelets to form a clot. The thrombolytics, appropriately called the clot busters, attack of dissolved blood that have already formed. Each of these three drug groups are discussed separately. First, a anticoagulant drug. Anticoagulant, also known as blood thinner, are medication that help prevent the formation of blood clot. They work by interfering with the clotting process in the blood. Common anticoagulant drug called warfarin, heparin, and direct oral coagulant or DOACs, such as apixaban and rivaroxaban. Side effect of coagulant drug may be include bleeding. Bleeding. The most significant side effect of anticoagulant therapy is an increased risk of bleeding. This can manifest as easy bruising, prolonged bleeding from cuts, nosebleeds, and gastrointestinal bleeding. In rare cases, severe bleeding can occur which may require medication attention. Next is the antiplatelet drug. Antiplatelet medications are used to inhibit the clumping of platelets in the blood, reducing the risk of blood clot formation. They are commonly prescribed to prevent heart attack, strokes, and other cardiovascular events. Aspirin and clopidogrel are examples of commonly used antiplatelet drugs. The side effects of antiplatelet drugs may include increased bleeding tendency. Antiplatelet drug can increase the risk of bleeding, similar to anticoagulants. It may cause easily bruising, prolonged bleeding from cuts, nosebleed, or gastrointestinal bleeding. As with anticoagulants, severe bleeding is rare but impossible. Next is the thrombolytic drugs. Thrombolytic drugs, also known as clot-busting drugs, are used to dissolve blood clots that have already formed. They are typically administered in emergency situations such as acute myocardial infarction or heart attack or ischemic stroke. Side effects of thrombolytic drug may include increased risk of bleeding. Thrombolytic drugs significantly increase the risk of bleeding. This can manifest as internal bleeding, bleeding in the brain, gastrointestinal bleeding, or bleeding from other sites. Due to the risk, thrombolytic therapy is carefully managed and monitored in a hospital setting. It is important to note that the specific side effects can vary depending on the medication dosage, individual patient characteristics, and other factors. It's crucial to follow the prescribed dosage and inform your healthcare provider if you experience any unusual or severe side effects while taking this medication. Regular monitoring and communication with your healthcare team can help manage any potential side effects and ensure the medication we are working efficiently for you. Management of ST elevation myocardial infarction. A myocardial infarction or MI, also known as heart attack, occurs when blood flow decreases or stops in the coronary artery of the heart, causing damage to the heart muscles. The most common symptoms of chest pain or discomfort, which may travel into the heart, shoulder, arm, back, neck, and jaw. Often it occurs in the center or left side of the chest and lasts for more than a few minutes. So, for the common drug prescribed in myocardial infarction, these are several classes of drug prescribed after a heart attack. These may include drugs that lower cholesterol or statins, reduce blood clot formation or blood thinners, lower blood pressure or antihypertensives, minimize chest pains or nitrites, reduce heart rate or beta blockers. So for the early recognition and emergency response, the first step in managing STEMI is early recognizing of symptoms and prompt activation of emergency medical service or EMS. If someone experiences symptoms such as chest pain or discomfort, shortness of breath, or pain radiating down the arm, they should call for emergency help immediately. Drugs for hemophilia. So, hemophilia is a genetic disorder where blood doesn't clot properly. To treat hemophilia, different drugs are used. Clotting factor concentrates. These are the main treatment. They replace the missing clotting factor in the blood. Hemophilia A is treated with factor 8 concentrates, while hemophilia B is treated with factor 9 concentrates. Next is the extended half-life factor concentrates. These are newer version of clotting factor concentrates. They last longer in the body, so newer doses are needed. Nonacog betapigol or N9-GP. This is a long-acting factor 9 product for hemophilia B. It also requires fewer doses. Emexizumab or Hemlibra. It's a drug that mimics factor 8. It helps preventing bleeding episodes in hemophilia A patients. Even those with inhibitors, it is given as subcutaneous injection. Next is the desmopressin or DDAVP. It stimulates the release of factor 7 and von Willebrand factor. It is used for mild hemophilia A and certain types of von Willebrand disease. It can be given in an injection or nasal spray. These treatments should be tolerated to each patient's needed. It's important to work with a hematologist or specialist to find the best treatment plan. Drugs for deficiency anemia. Deficiency anemia is a condition where the body lacks certain nutrients necessary for the production of healthy red blood cells. There are various types of deficiency anemia, each caused by specific nutrient deficiency. Here's some simple explanation of drug common use to treat deficiency anemia. The first drug is the iron supplement. Iron deficiency anemia is the most common type. Iron supplements are prescribed to replenish low iron levels. They help the body produce more red blood cell. Iron supplement can be in the form of tablets or liquid, and they are usually taken orally. Next is the vitamin B12 supplement. Vitamin B12 deficiency anemia occurs when the body lacks adequate level of vitamin B12, which is necessary for red blood cell production. Vitamin B12 supplement, and typically in the form of tablet or injections, help restore vitamin B12 level and improve red blood cell production. Next is the folic acid supplement. Folic acid deficiency anemia results from insufficient level of folic acid, a B vitamin important for red blood cell formation. Folic acid supplement, usually taken orally in tablet form, help correct the deficiency and promote production of healthy red blood cell. So it is important to note that while supplements can be effective in treating deficiency anemia, it is equally crucial to address the underlying cause of the deficiency. This may involve dietary changes, identifying and treating any underlying health condition or other intervention. Consulting with a healthcare professional such as a doctor or a hematologist is essential for accurate diagnosis and the appropriate treatment plan for deficiency anemia. Hematopoietic agent. So, hematopoietic agent are substance or medication that help with the production and function of blood cell in our body. They are used to treat different blood-related conditions. So, there are a few types of hematopoietic agent. So, first is the colony stimulation factor. This substance stimulates the product of specific type of white blood cell, which help fight infections. Next is the erythropoietic agent. This agent stimulates the production of red blood cell, which carry oxygen throughout the body. They are used to treat anemia. Next is the thrombopoietic agent. This substance stimulates the production of platelets, which are important for blood clotting. They are used to treat low platelet counts. Next is the immunomodulatory agent. Some agents can affect the bone marrow and help produce more blood cell. They are used in the treatment to certain blood-related cancers. Lastly is the hematinics. This substance promote the production of hemoglobin and aid in the formation of red blood cell. They are used to treat conditions like iron deficiency anemia. So, it is important to remember the hematopoietic agent should be used under the guidance of healthcare professional, as they can have a side effects and need carefully monitoring.